Falx Cerebelli. Studies have shown that the fibers from the falx cerebelli are continuous with dural ligaments extending into the upper cervical complex as low down as C3. That is why we have the context we have in this technique. And this technique is used to balance membranous strains inside this cranial base that involve these connections. So we start off with the infant supine or held in the caregiver's arms. We are going to be at the head of the child. And your contact is going to be very low on the occiput, inferior to the inion. We are going to place the fingers so that we are contacting in the midline of the occiput, just underneath the inion, along the sagittal plane of the occiput, because this is going to approximate the location of the falx cerebelli on the inside of the skull. Ring fingers are going to meet in the midline and contact just inferior to inion. Middle fingers are going to approximate and lie just inferior to your ring fingers. And then your index fingers are going to contact the second cervical vertebra, medial and posterior to its TVP. It's a steady, gentle anterolateral pressure that you're inducing through the ring and middle fingers, and it's directed into that deep connective tissue of the falx cerebelli. Your index fingers are monitoring change at C2. As the tissue texture under the ring and middle fingers begins to change, and the index fingers can control C2 to establish balanced membranous tension through the upper falx cerebelli and its dural connections to the upper cervical complex. Once we have a balanced membranous tension, we're going to feel that there's a softening, a potential change to tissue texture, or a correction of the strain.